Every 5 minutes, someone is diagnosed with one of the 5 GYN cancers: cervical, ovarian, uterine or endometrial, vaginal, and vulvar. That's more than 115,000 Americans per year. So it's important that every woman knows her risks. I'm joined by Dr. Ebony Hoskins, who's a gynecologic oncologist at MedStar Washington Hospital Center. Thank you so much for being here. That sounds like some high numbers that we should talk about.
We definitely need to talk about it, and this is a good time.
Yeah. Is there one of those types of cancers that's more prevalent than the others?
Well, that's an excellent question. The numbers are on the rise for uterine cancer, and that's typically a cancer of the lining of the uterus. Is called endometrial cancer, so that's on the rise.
Okay, do we know why that's on the rise?
Well, we see that it's correlated with obesity, so there may be some hormonal factors in terms of the rise of the cancer.
Okay, and I know they're all a little bit different, and so there might be different risk factors, but
Right.
You mentioned obesity. Are there other things that women need to know that are risk factors?
Right, so we are talking about the 5 cancers. Most common would be uterine cancer, ovarian cancer, cervical cancer, vulva cancer, and as well as vaginal cancer. So for uterine cancer, postmenopausal bleeding is probably the biggest risk factor, or abnormal uterine bleeding in a woman who may not have gone through menopause yet. Well, patients who have ovarian cancer may have abdominal bloating, distension, pelvic pain, very nonspecific symptoms that may not be picked up early.
And sometimes they mask other things, so it's really important to educate yourself. And
Absolutely.
I know you have an event coming up to do just that. Tell us about that.
Yes, so Move for Her is an event that is sponsored by the Foundation for Women's Cancer, and that is from the Society of Gynecologic Oncologists. We want to raise awareness about these 5 cancers. So not just raising awareness, but advocacy and really research funds so that we can eradicate gynecologic cancers.
Yeah, so what can people expect if they come to this event?
So this event is tomorrow at the National Press Club. It's 10:30 a.m. to 12 p.m. and we will be educating about the 5 cancers we discussed, and we also will be moving for her. So we'll be moving our bodies, 5 minutes, 5 different exercises during that time, and of course a time to interact with other survivors, specialists in the field, and people from the community. So we're very excited about it.
Good. It sounds like it's going to be a phenomenally fun event. I think I saw 100. They have space for 100. So those that are going are going to have a wonderful time. If you can't go and you want to learn more, where would you direct people?
Well, if you can't go, you still can participate virtually of moveforher.org. You can sign up and learn more information there, and even donate. So if you can't participate physically, we are still accepting donations for the cause.
Yeah. Thank you so much for being here and for sharing this, because we don't always talk about women's health as much out in the open, and even young women need to learn about these things. We don't want to wait until they happen to us and then try and figure out what to do with it. Let's talk about things that we can do to prevent, perhaps, and like you said, more research.
Yes.
And
So if we can look at moveforher.org, you can learn more.
Okay. Well, we're putting a link on the screen to register for the 2023 Move for Her event at the National Press Club. It's happening tomorrow from 10:30 a.m. to noon, and there you will get to meet top gynecologic oncology experts like yourself. I know you'll be there, right? You can speak with survivors and learn more about the latest research and education. And you can get a workout too with a Pure Barre fitness instructor. I love Pure Barre. All right, we'll be back right after the break.